listening to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeartMedia. We are also on podcast on Spreaker. I have my co-host Jeannie Roller on Skype with me. She's in Indiana. Jeannie, how are you doing today?
I'm fine. How are you?
I'm good. So let's get right to it. The topic today, we were talking about naked patients, naked doctors. You read an article about this. This is just unbelievable, some of the stuff that gets written, and we're trying to figure out why patients have to be naked for all these surgeries and what the big deal is about this, and why, when you say that you don't want to be totally naked, and I'm not laughing at, I'm kind of laughing with it, why this is even happening. Why do you have to be totally stripped naked is what we want to know for foot surgery, for your incision in your finger, or, your heel of your foot, or maybe your knee. We just can't figure it out. So what do you think, Jeannie?
Well, I read this article in MedPage Today, July 20th, 2021 edition, an article called Naked with Other Doctors, written by Robin Ailey Hay. And she is a female doctor, and I didn't realize that until I got to the end of the article. But it talks that after a conference, they went to a hot tub to get rid of the stress and the strain of the day, and all were naked except for one other physician. Mm-hmm. And she was thinking, well, I see naked patients all day long, and I really don't care that they're naked.
Now, these are male and female patients together, doctors together in this hot tub.
Well, I think it's all female.
Okay.
So, they had that little thing in their favor, and it's in the moonlight that they're naked, and she was really, she came to the realization that she sees naked patients all day long because she's an OB/GYN, mm-hmm. and she really doesn't think about them and their nakedness. They're being uncomfortable with other people seeing them naked, especially when the other people in there are fully clothed. Mm-hmm. They're in a bright lit room. A lot of times they're in a cold room, and this physician was more worried about her nakedness with her fellow physicians, but as she was drinking her wine, then she lost her inhibition. So it just really points out to me that they really have no understanding of the stress that they put patients through when they require patients to be naked, especially when they require patients to be naked unnecessarily, and when they require patients to be naked in front of more than one person, and especially if those people involved are clothed and of the opposite sex.
So you're talking about the staff people that are clothed, both male and female staff, and yes. The patient is in there and the patient's totally naked.
Yeah. And I mean, this woman, she said that that they have a drape for their comfort, but I certainly gave it no thought, was her exact words. So, I mean, to her, the nakedness of her patients doesn't really matter to her, that she isn't concerned about safeguarding their dignity, but she was concerned with safeguarding her nakedness from the other physicians until she had enough wine in her that she doesn't care, which, if you think about it, is what happens to patients, because during a procedure, before the procedure, after the procedure, they give you enough drugs to make you also versed, not have that thought of being naked bothering you. So, I mean, it is just the audacity of this situation that they know it's wrong for them. They have objections for it happening, but for us, it's like, well, what's your problem?
Well, because they're saying that this is just part of the game, and this is the way it, works when you have surgery, and that's just it. Buck up.
Right. And that's exactly what they do. And I mean, that this doctor, she admitted that she really didn't care that her patients were naked. She didn't, a drape is not for their comfort. A drape doesn't do much. There's a chaperone in there who's also fully clothed, and their sole job is just to watch the naked patient. Mm-hmm. That's it. So it's a little bit different than a hot tub full of doctors drinking wine in the moonlight. And that this doctor really didn't realize that there is a big difference, and that she needs to have more compassion towards her patients.
So the thing that kind of comes to mind for me on that conversation is, she's a female GYN doctor, so I think she should have a little bit more compassion. Yes, if you've ever had a baby, you know that a lot of stuff is exposed, down there, for lack of a better term. We know that. We know how babies come into the world. But on the other side that I think about is, let's key in on some of the doctors, and we've had them on shows about cover medical garments, modest patient medical wear, that those orthopedic doctors are concerned about both the patient and their staff, because it does bother a lot of the staff too. And what's the whole dynamic of this on why you have some doctors that really don't care and other doctors that really do care? It's such a quandary.
Right. The difference in having a baby is most of the time the staff, unless you choose to have a male OB, is going to be female. Most of the time the staff is going to be female.
Well, it should be, yeah.
And the nudity down there is something you cannot get away with having, and you accept that when you get pregnant to have a baby. But I'm talking about most of the time patients are exposed unnecessarily, and that is different. This doctor going into the hot tub had a choice. And patients, when they go in for pre-op procedures and post-op, they don't have a choice. It is done to them.
Well, the thing, too, and we've asked this on other shows, and we've had people come on, talk on the show here, that this has happened to both men and female patients, that the patient should be given this information from the get-go. I'm the doctor that, this is what's going to happen in your surgery. You're not going to have a gown. You're not going to have a blanket. There's going to be no sheet. Basically going to be naked on the table. That's the way we choose to. Why aren't we being given this information when you can go to this other doctor and say, okay, Dr. So-and-so, how would you perform this procedure? What's the pre-op and whatever? Okay, well, you have your gown. You got your warm blankets. Okay, that's the doctor I want to go to. I should be able to make that choice as a patient.
So you just answered your own question.
Right.
That's why they don't do it. They don't want you to know. They don't want you to have options. They don't want to have to deal with the issues that you may have. They don't want to have to accommodate you.
And the other side to it is, and we can bring this up, is the drugs that we talk about, midazolam, which is also Versed, and also fentanyl, which is a synthesized heroin, however many times worse than heroin is. So these are the drugs that they're giving us, among other drugs, that inhibit our, modesty or whatever, dignity or whatever. So they're also creating this whole dynamic here with these powerful drugs, and people cannot necessarily take these drugs. But they're being forced to get to the ulterior motive, which is to strip the patient naked, from what my experience is, and a lot of people that I've talked with, your experience, Jeannie. Why? Why is this happening? And why is no one questioning it? And then you're the patient on the opposite end coming out of recovery. You have no clue why you were just assaulted like this.
Yeah.
And other doctors are saying it doesn't need to happen. We don't do it that way. Who do we ask?
Well, that's the thing. Who do you ask? I mean, the one lady, she asked the doctor. The doctor said one thing. The hospital did another.
Yep.
So, I mean, there is no trust. I mean, you can get things in writing, like on your consent form. But again, I know people who've gotten things in writing and it's been totally ignored. And what can you do about it? Basically nothing. Right.
So that's why we keep talking about this, because we're going to have to get to the bottom and the reasoning behind this, if we can, to save people. We've got like a minute left, Jeannie, to save people from going through these horrors that we've gone through and thousands and tens of thousands of other patients have needlessly.
Right. And I want to emphasize this. This is not about modesty.
No, it
isn't.
isn't.
It's about personal dignity.
Yeah.
Your right to privacy, your right to dignity, a basic human right.
Right. I mean, that's like giving a pap smear in Times Square with, people walking by. That's the way we feel about this.
Right, right.
I mean, come on. That's not medicine, and it's not, buck up, shut up. This is the way we do it. It isn't.
No, it should not be ever like that.
No, it shouldn't. So we're going to say I got a couple seconds left, a quick thank you to Misty Roberts at Medical Patient Modesty. She's on Facebook. And you have been listening to Planet Vero Radio. Please stay tuned.